Good evening. This is Dr. John Bennett broadcasting from Miami. Tonight we have another in the series of Parkinsonism educational hangouts with Dr. Abdul Rana, a noted Parkinsonism educator from Toronto. He's a neurologist. He's been doing a bunch of these educational hangouts. And tonight, Dr. Rana is going to be covering the young onset Parkinsonism disease. Good evening, Dr. Rana.
Good evening, Dr. Bennett.
Okay, let's start right off here. And this is a topic I'm looking forward to hearing from. How is a usual onset of Parkinson's?
Parkinson's disease usually starts on one side of body. Most of the patients would be presenting with asymmetrical symptoms. They have symptoms on one side, or if they present a little late, so the symptoms may be on both sides, but on one side they are more prominent. It is called asymmetrical onset. Some patients would be presenting with a tremor. The tremor could be very mild. It could involve just the index finger or thumb, or index finger and both, or a few fingers, because it goes like this. So classically it's called as a pill rolling tremor. So it may not be pill rolling. In some cases it could be the whole hand, supination, pronation, like side to side movement, and in other cases, less commonly, much less frequently, it could be flexion extension like this, up and down movement of the hand. So in other patients, they could have leg tremor. When they're sitting, their leg may shake. One leg usually may shake, but the moment they stand up and start walking, the shaking of the leg disappears. Usually Parkinson's disease does not cause head tremor. In some cases, patients may have a chin tremor or a lip tremor or a jaw tremor in some cases. But jaw tremor is seen with other conditions as well, such as essential tremor. So you have to look at all the symptoms to decide what patients have. In some time, the patients may be presenting with the slowness of one side of body when they're walking. So that whole side legs behind, either their legs behind or their arm stays behind. And at other time, patients may have decreased arm swing on one side. When they're walking, they don't swing one arm as compared to the other arm. So that could be a common presentation of Parkinson's disease. And some patients may present with fascination. They may be brought by family members and say that they were running involuntarily, they stop walking and they run and they can't they cannot stop to avoid any obstacles and they fall as a result. Or sometimes, if wife and husband go for a walk daily in a routine, the husband starts or the wife, they start having slowness in the speed of walking, and they can't catch up. So they would note that, and they would say that there is some change in their condition, that they cannot catch up, they are left behind. So that could be presentation. In other cases, patients may be presenting with drooling. Just they have subtle drooling at nighttime. When they wake up, their pillow is wet. And some patients may have been noted by their family members to have expressionless face. And they might say that they are not participating in their conversations, in the family conversation. They're quiet most of the time. Their face appears blank. So these are common presentation in the classic Parkinson's disease, which is adult onset Parkinson's disease. But there could be many other subtle presentations which could vary with the age of the patient sometimes. But if a clinician does a very careful assessment of the patient, even if obvious or apparent symptoms are on one side, you can detect subtle symptoms on the other side of the body, but you need a very keen and vigilant physical examination.
So Parkinsonism disease is not just a disease of the elderly.
It's a common perception among the public that the Parkinson's disease affects elderly or people when they develop symptoms of Parkinson's disease. If they are seniors, they would attribute them to aging, but that is not completely the case, because Parkinson's disease does happen in other age groups. And as we are learning more, we are seeing more and more young cases of Parkinson's disease. So we divide the onset of Parkinson's disease with respect to age usually into 3 phases. Up to age 20, we call it juvenile onset Parkinson's disease. And then from 20 to 40, it's usually called young onset Parkinson's disease. And the regular idiopathic Parkinson's disease, the adult onset, most patients would be presenting around 55-ish or 60. Which is the bigger group of the patients. So about 10–15% of the patients are relatively in the younger age, in the juvenile onset, but most patients still are presenting between 50 and 60 years of age. But it's not completely true that Parkinson's happens only in the elderly patients. So, about 10% of patients may have the first symptom of Parkinson's disease before the age of 40.
Okay. Any difference of young onset from classic Parkinson's?
Usually there are no major differences. The symptoms of young onset Parkinson's and the classic adult onset Parkinson's are about the same. The presentations are same as well. But with respect to the progression, in the younger age group, the progression of disability may be a bit slow as compared to the elderly patients. Younger age patients may be able to work for next 8 to 10 years after the diagnosis is made, or sometimes even longer. However, individual exceptions are there. Sometimes there could be some younger age patients who may have disability faster. So the exceptions always happen, but as a overall observation, so these patients progress much slower. And in the younger age group, there are certain symptoms which seem to be more prominent as compared to elderly patients. I'm still a student of Parkinson's disease and movement disorders, and every day you learn different things. In my own observation, in younger patients, there is more higher incidence of focal dystonic spasms, or maybe shoulder cramping or foot cramping, and aching or painful type of symptoms as compared to the elderly patients. About half of the patients with young onset Parkinson's disease may not have a tremor on the initial presentation, or they may not have tremor at all throughout the course of disease. But some patients who did not have any tremor at the initial presentation, they might develop a tremor later. Also, in younger age group, the dyskinesias, they seem to occur much earlier than the elderly population. And the dyskinesias could happen in relatively early phase of Parkinson's disease in these patients. However, dyskinesias may not be bothersome, especially in the beginning of the disease. The dyskinesias could be bothersome to the family members, but patient may not even know them sometimes. Other symptoms could be depression, which could be much earlier in the younger age group as compared to the elderly patients. Also, dementia and balance problems, they seem to be less common in the younger age group as compared to the elderly patients. So elderly patients more have dementia, balance problems, cognitive issues. The younger age group has more of cramping and dyskinesias and painful symptoms and depression. So these are subtle differences which may apply in some cases and may not apply in every young age patient, because these symptoms could happen in the elderly patients as well.
Generally speaking, is the course of the young onset different from classical Parkinsonism?
Usually there is no significant difference, but sometime the younger age patients may have a bit smoother long-term course of disease as compared to elderly. Now, it may reflect that they have fewer other coexisting health problems than the elderly patients. such as diabetes or heart issues or stroke or other so many other issues may be more common in the elderly patients as compared to the younger age patients. So these other coexisting health issues may make the course of elderly patients more complicated as compared to younger patients who are relatively healthy. The rate of progression is lower in the young onset Parkinson's disease patients as compared to the elderly patients in most of the cases. However, as I said before, there are individual variations.
Any difference in treatment between young onset Parkinsonism and classic Parkinsonism?
Most patients are treated the same way. Beside age, there are many other considerations which need to be taken when a decision is made about the treatment, such as the degree of the symptoms, the nature of the symptoms, or the functional status of the patient. Suppose if the patient is younger and they have relatively milder symptoms, so then we try to treat them with relatively milder medications, such as dopamine agonists or monoamine B inhibitors, because younger patients still, they are more sensitive to develop motor fluctuations and dyskinesias. So if their symptoms are mild, we try to treat them with the milder drugs, and levodopa may be added later in the course of the disease when their symptoms progress, because sometimes we have seen in patients, younger age patients, when they were started on levodopa and they had milder disease, they developed the motor fluctuations, which are the symptoms of on and off, which usually occur later in the course of disease. But in younger patients, they are much more sensitive to these motor fluctuations. They are also more sensitive to dyskinesia. So younger patients, if they have milder disease, and so we try not to use levodopa in them if they don't need it, because if you treat them with levodopa, the dyskinesias may appear very quickly. And once dyskinesias appear and they progress, then if they become disabling, that becomes a real challenge to manage these patients. And so with respect to the onset of the side of the body, if the symptoms are right-sided and patient is younger, so we try to treat them early on relative to if the symptoms are left-sided and the disease is very mild and patient does not know any functional impairment, then they could be observed for a short period, although most experts now start recommending that the Parkinson's disease should be treated at the time when it's diagnosed, and we should not delay it. The traditional approach before was because it's a symptomatic treatment, so you can delay it. Most experts these days treat it in the beginning. Also, if a patient is in a high-functioning job or in a demanding situation, then of course the treatment should be started in the beginning, so that they don't have impact on their job or their working capacity. In addition to this, some of the side effects of levodopa, such as restlessness or involuntary writhing movements or twisting movements, they may involve the head or eyes or mouth or trunk and shoulders. They could appear in the younger patients relatively quickly as compared to the elderly patients who may not have most of these symptoms. So due to these precautions, it needs a very careful decision when it comes to a young patient to start that what medication should be started. So you need to consider not only age but also the degree of the symptoms and the side effects of medications, functional status of patient, and these different and all these different factors. Another thing in younger patients is that if they do develop dyskinesias or motor fluctuation, which become difficult to manage, they become refractory. So they may be better candidates for for surgical treatment, such as deep brain stimulation, as compared to elderly patients. If the patients are elderly and they have other coexisting diseases, it might be difficult for them to undergo the interventional treatment as compared to younger patients who, if develop the motor fluctuations or dyskinesias, they would be considered easily for the surgical treatments of Parkinson's disease.
Very good. That's a good overview of young onset Parkinsonism. Anything else to add before we close on this topic, Dr. Rana?
Yeah, just my personal observation in some cases, because there is a perception in the public or even in healthcare workers that Parkinson is a disease of elderly. So I have seen several patients in which their symptoms were discounted, especially if they don't have a tremor. So they just have a slowness on one side or trouble with dexterity. So they may be considered to have a carpal tunnel syndrome or something else. And there were several patients which I came across. They were young patients and they didn't have a tremor, so they were considered psychogenic. They were considered that they could be functional and because they're young and so they're a bit slow. So it's really difficult to pick up those symptoms and come to a conclusion, diagnostic conclusion. So there is a tendency to be labeled as non-organic symptoms in those patients. So I think a careful assessment is very important. And then another thing would be looking at all other factors. Do they have any secondary gains or something like this? Or seeing them maybe more than once, seeing them again after some period, in documenting the symptoms initially and then making the comparison would help the physician to reach a conclusion that these patients have Parkinson's disease, rather than ignoring their symptoms or labeling them with a non-organic condition.
Very good. Thank you, Dr. Rana, for a good treatment of young onset Parkinsonism. And stay tuned for tomorrow night for another in the series. And this video will be on Parkinsonism.tv. So thank you very much, Doctor.
Thank you, Dr. Bennett. See you tomorrow.
Good night.